Hi everyone, Humanity2020 Group comfort ourselves in taking the time to structure a highly trained staff of crisis peer peace practitioners, clinicians, therapists, and psychiatrists that care about your state of mental balances and your recovery. We recognize each patient requires different needs, which is why we offer mobile crisis response and community brief care support with options to corroborate the best path to recovery. Our mission is to utilize our voice, not force. Humanity2020 Group provide collaborative mental health services to improve and restore community mental health and quality of life. We accomplish our mission by being frontline street triage social crisis intervention mobilizing team that respond to non-emergency and non-violent for people who are mentally ill, who are intoxicated, or disoriented, those who are experiencing a crisis at moment. Where we utilizes our voice, not force. Humanity2020 Group Mobile Crisis Response Team provides immediate deployment, screening and intervention for adults who are suffering from crisis. Our coordinated team of certified crisis peer peace practitioners and licensed healthcare professionals visit individuals and their families in the community to reduce harm, prevent crises from becoming an emergency that requires hospitalization or involvement from law enforcement. Our team includes licensed mental health clinicians, certified crisis peer peace practitioners and support staff to provide a holistic approach in caring for the individual's immediate needs and coordinating care to provide long-term and sustainable care to the individual. Call 988 if there is a crisis. We believe that every client is unique, and we respect different backgrounds and experiences when developing individualized treatment plans to meet specific needs. A trained behavioral health professional will speak with you and will ask about the situation, as well as the person's name and location. They will complete a brief screening by phone to determine next steps. If there is a need, a crisis peer peace practitioners will provide a face-to-face intervention to assess and stabilize the situation, then perform assessment to determine your needs with an on-call licensed clinical evaluator, who will help to talk with family members or loved ones and provide resources for your care. Our compassionate, experienced, and trained staff of professionals provide excellent care in safe environment that fosters healing for clients. Mobile crisis response team works directly with law enforcement and, if necessary, may bring local law enforcement on site, depending on assessment and safety needs. After crisis stabilization, mobile crisis response team will follow up with the individual to make sure there is a continuing care plan to help with the individual's long-term health. When local police show up, with their guns and badges, which is a big part of their job, is enforcement. When crisis peer peace practitioners show up, they can soften the situation by almost immediately de-escalate the situation, which is Humanity2020 Group secret sauce. Confrontations between police and people with mental illness can also lead to less than deadly injuries to either party. All of these interactions consume police time, energy, and resources from officers who all too often lack the training and expertise to know how best to de-escalate a confrontation. Since the beginning of 2015, 1,430 people with a history of mental illness have been shot and killed by police in the U.S., according to a database created by The Washington Post, almost a quarter of all fatal police shootings. In the 11 months from the murder of George Floyd to the conviction of police officer Derek Chauvin in April 2021, 181 people with histories of mental illness were killed by police. Including one cases from Shreveport, Louisiana. Jonathan Jefferson was murdered by Shreveport police for having a mental illness, as it was justified by 21-second rule. Having a mental illness and manifesting symptoms seems to increase the risk of being killed, the worst possible outcome, in a confrontation with police. Senator Wyden said, "The system today calls for a response that is sensitive to what's really going on in the streets, and that's not what you get. The aftermath of violence, even fatal violence by law enforcement, particularly against subjugated African Americans," says CEO Makie Jackson. Confrontations between police and people with mental illness can also lead to less than deadly injuries to either party. All of these interactions consume police time, energy, and resources from officers who all too often lack the training and expertise to know how best to de-escalate a confrontation. After crisis stabilization, Humanity2020 Group Mobile Crisis will follow up with the individual to make sure there is a continuing care plan to help with the individual's long-term health. Our objective is to provide a safe and secure alternative to the deadly force by police as we create and maintain a feeling of safety and security for all by decreasing the amount of actual or perceived police-involved killings. Call H20 for help. Call 988 right now.